So most patients these days will come to a urologist if their PSAs are elevated or if they have an abnormal rectal exam at the time of their primary care visit. When they come to a urologist, the question at hand is prostate cancer present?
For a long time, patients who had any clinical suspicion would go straight to biopsy, and that was generally done with just ultrasound guidance in the office.
Biopsy accuracy has been a problem because when we sample the prostate with a needle biopsy, we can only sample a small percentage. So therefore, there are areas of the prostate that can be missed.
The standard has moved in a lot of places to getting an MRI prior to biopsy now, so that MRI basically provides a map of the prostate. If there are any abnormal regions that are higher suspicion for cancer, we can then target those areas at the time of biopsy.
MRI is a procedure that is sometimes difficult for people if they have claustrophobia. It can take 45 minutes for that MRI exam of the prostate, which is a long time in an MRI machine for patients, and there's a cost. So we are now using additional technologies to determine if one should have a biopsy, and if so, can we improve the accuracy of those biopsies?
Micro-ultrasound is essentially a very high-resolution transrectal ultrasound. It can be utilized to visualize areas in the prostate that are higher suspicion for cancer, things that could not be generally seen with a standard ultrasound that otherwise would probably require an MRI to see.
So the goal of utilizing micro-ultrasound is to be able to find areas that are suspicious within the prostate and target those areas. So normal ultrasounds are 7 to 9 megahertz. With micro-ultrasound, it's performing at around 27 to 29 megahertz, which is a 300% more detail at looking at the prostate.
So the OPTIMUM trial was a multinational, multi-center trial, 20 different centers participating, investigating our standard biopsy pathway of MRI followed by targeted biopsy compared to this new technology utilizing micro-ultrasound biopsy. So this trial showed that this micro-ultrasound based approach was equivalent to an MRI-guided biopsy.
This is a benefit to our patients because now they are able to go for one procedure. It allows for equivalency with regards to diagnosis. It allows them to not have delay to their procedure while waiting to schedule an MRI. Right now, we are one of the only sites available for micro-ultrasound in New England.
I think the hope is that as it gets taken up into the wider population, that we see more patients being able to have a higher probability of finding a cancer if it's there. The hope, of course, is that finding those cancers earlier allows them to get treated earlier and leads to better outcomes in the long term.